Ahifena. Parts used: Kshira, latex, bija, seed. Rasadi Panchaka, Rasapanchaka, Niryasa, Falatvaka, Bija, Rasapanchaka, Rasa, Guna, Virya, Vipaka. Rasa, Tikta, Tikta Kashaya, Madhura Kashaya, Guna, Ruksha Ushna, Ruksha Laghu, Guru, Vipaka, Katu, Katu, Madhura, Virya, Ushna, Shita, Shita, Prabhava, Madaka. Karma, actions: Niryasa, latex, Grahi, Madaka, Ruchikara, Agnivardhaka, Stambhaka. Palatvaka, fruit bark, Grahi, Mohakara, Rucha, Agnivardhaka. Bija, seed, Balya, Vrasha. Pharmacological actions: analgesic, hypnotic, sedative, narcotic, respiratory depressant. Analgesic, hypnotic, sedative, narcotic, respiratory depressant. Dosha karma: Niryasa is Kafahara because of its Ushnavirya. Bija is Pittahara because of its Shitavirya. Rogagnata, indications: Niryasa, Shula, Atisara, Agnimandya. Bija, Daurbalya, Klaibya. Amayika Prayoga, therapeutic administration. First, Daruna, dandruff, paste prepared from Ahifena seeds and milk, if applied over scalp, will destroy dandruff. Atisara, diarrhea. Ahifena mixed with bark of kupilu and honey gives, if given, checks all kinds of atisara, diarrhea. Matra, Afima 30 to 125 mg, Churna 1 to 2 gram, Bija 2 to 5 gram. Afima 30 to 125 mg, Churna 1 to 2 gram, Bija 2 to 5 gram. Phytoconstituents: alkaloids of opium are divided into two groups: phenanthrene group and benzyl isoquinidine group. Phenanthrene series, benzyl isoquinidine group. Phenanthrene series, morphine, codeine, thebaine. Benzyl isoquinidine group, papaverine, noscapine, narcinine. Important formulations: Ahifena Asava, Ahifenadi Churna, Ahifenadi Vatika, Jatipaladi Vati. Botanical name: Papaver somniferum Linn. Papaver, member of Papaveraceae family. Somniferum, produces sleep. Family: Papaveraceae. Classification: भावप्रकाश निघंटु, हरितक्यादि वर्ग. Classification: भावप्रकाश निघंटु, हरितक्यादि वर्ग. Ahifena. Ahifena latex is very strong, like venom of cobra. Synonyms: Kshira, Fanifena, Nagafena, Afuka, Khasafala Kshira. Fanifena, Nagafena, Afuka, Khasafala Kshira. Bija, Sukshma Bija, Sukshma Tandola. Sukshma Bija, Sukshma Tandola. Regional names: English, opium, poppy seeds. Hindi, खसखस. Kannada, अफीमो. Marathi, खसखस. Habitat: in India, it is cultivated in Uttar Pradesh, Rajasthan, Madhya Pradesh, Bihar. In India, it is cultivated in Uttar Pradesh, Rajasthan, Madhya Pradesh, Bihar. Morphology, habitat, an annual herb with latex, an annual herb with latex, root, taproot, branched, stem, erect, herbaceous, green, cylindrical, hairy with latex, leaf, simple, alternate, sessile, sheathing base, lobed, reticulately veined. Inflorescence, solitary, terminal cymodes. Flower, pedicellate, actinomorphic, bisexual, complete, hypogynous, large, red or white colored. Fruit, small, white or black. Varieties, according to color of the flower: Shweta, Pita, Krishna, Chitra. Shweta, Pita, Krishna, Chitra. According to action: Charana, Marana, Dharana, Sarana. Jarana, Marana, Dharana, Sarana. Different species: Papaver glabrum bios, Papaver album DC, Papaver nigrum DC, Papaver setigerum DC. Papaver glabrum bios, Papaver album DC, Papaver nigrum DC, Papaver setigerum DC. Different preparations: raw opium. It is dried latex obtained by incision from the unripe fruit capsule of Papaver somniferum, dried and partly dried, or spontaneous evaporation, and worked into somewhat irregularly shaped masses or molded into masses of more uniform size and shape. It is dried latex obtained by the incision from unripe fruit capsule of Papaver somniferum. Poppy seeds. Seeds are collected from the poppy capsules. The seeds are very small, about 1 to 1.5 millimeter diameter. Poppy straw. Dried opium poppies are referred as poppy straw. Dried opium poppies are referred as poppy straw. Adverse effect and remedial measures. Signs and symptoms of acute poisoning. Signs and symptoms of acute poisoning. There are 3 stages. First stage of excitement, second stage of stupor, third stage of coma. First stage of excitement: sense of well-being, freedom from anxiety, restlessness, hallucination, flushing of face, increased action of heart. In children, it may present with convulsions. Freedom from anxiety, restlessness, hallucinations, flushing of face, increased action of heart, and in children it may present with convulsions. Stage of stupor: depressive action starts. Headache, heaviness of body, fatigue, giddiness, drowsiness, and intense desire to sleep. Pupils contracted and pinpointed. Face and lips slightly cynosed. Pulse and respiration is normal. Stages of stupor: depressive action starts. Headache, heaviness of body, fatigue, giddiness, drowsiness, and intense desire to sleep. Pupils contracted and pinpointed. Face and lips slightly cynosed. Pulse and respiration is normal. Stage of coma, third stage: No response to talking and shaking. Latter, no response to deep pain. Relaxation, relaxed muscles, reflexes are lost. All secretions except that of skin are depressed. Pupils contracted and insensitive to light. Feeble pulse, slow, low blood pressure. Third stage of coma. No response to talking and shaking. Latter, no response to deep pain. Third, relaxed muscles and reflexes are lost. All secretions except that of skin are depressed. Pupils contracted and insensitive to light. Feeble pulse, slow, low blood pressure. Treatment, gastric lavage with potassium permanganate, KMnO4. Gastric lavage with potassium permanganate, KMnO4. Endotracheal clearance. Second, endotracheal clearance. Third, hot bags and blankets should be used to maintain the body heat. Hot bags and blankets should be used to maintain the body heat. Fourth, administering the antidote nalorphine hydrobromide in the dose of 5 mg IV should be given. Administering the antidote nalorphine hydrobromide in the dose of 5 mg IV should be given. Fatal dose, crude opium 1 to 2 gram, tincture opium 3 to 4 ml, morphine 60 to 180 mg injectable, codeine 200, 400 mg, heroin 20 to 30 mg, crude opium 1 to 2 gram, tincture opium 3 to 4 ml, morphine 60 to 180 ml injectable, codeine 200, 400 mg, heroin 20 to 30 mg. Fatal period 45 minutes to 12 hours. Fatal period 45 minutes to 12 hours. Ahifena is contraindicated in Bala, Vruddha, Madhumeha, Visuchika, Shleshmika Kasa, Vrukka Shotha. Ahifena is contraindicated in Bala, Vruddha, Madhumeha, Visuchika, Shleshmika Kasa, Vrukka Shotha. Purification. Ahifena is subjected for trituration with Ardraka Swarasa for 21 times. Ahifena is subjected for trituration with Ardraka Swarasa for 21 times.